Hi, good evening. I'm Dr. Philip McMillan. For those who are interested in the journey of research around COVID 19, I hope that you enjoy these videos that try and expand on our understanding of the disease. My view is that COVID is not over. We're only starting to see the beginnings of what could be another significant wave. And as recently spoken with Gert, who predicts a more virulent form of the virus, I'm looking at solutions. I'm trying to see if I can understand the mechanism of disease to try and then find ways that we can make people well. As was said by Abraham Lincoln, if you gave him an axe to cut down a tree, he would spend the first 4 hours out of 6 sharpening the axe. I consider looking and understanding COVID 19 as being a route of sharpening that axe to try and figure out how to get solutions. So, what I'll be doing today is I'll be talking about a paper, interaction between the gut microbiome, COVID 19, and its vaccines, and looking at a few images that help to hopefully clarify some of my thoughts around what could be going on. This is just again an exploration of science. I can't tell you exactly why this is occurring, but I do sense that it is very, very important. As usual, at the start, it requires us to deal with an important question of the elephant in the room. This elephant is slightly different, though, because this elephant is about the origin. If you have a virus that is operating in a way that you have never seen before, and there is a question about where it may have come from, pretty good chance that you need to find the source. That's a really important question because if what we're dealing with is not typical, it is unlikely that the solutions are going to fall within the box of what we have done before. And that's an important phase as to what we need to do, facing the reality of what we're dealing with. So let's get back to the point. How can COVID vaccines and COVID infection have an impact on gut bacteria? So, this is from a paper that was published in 2022. So, in October 28th, 2022. And it's looking at the interaction between gut microbiome biota and COVID 19 and its vaccines. It was produced by John Leung, and he's in China. And so, quite a bit of the data came, I think, from Hong Kong as well. And some people I find are getting, I guess, a little bit fussed with China. I can say from the early part of the pandemic, when China started to release its data, goodness, I couldn't have figured out autoimmunity without that amount of data that they produced. It was so valuable. So, in the context of pure data, the Chinese do the scientists and medics do an incredible job, and they need to be credited for it. And this is another one of those very important pieces of information. It's important to highlight that when we spoke to Carlo Brogna here, and he was talking about identifying the circulating vaccine spike protein, we didn't get much chance to highlight the fact that he was one of the first researchers to identify that the virus is somehow interacting with bacteria to produce toxins. It is such an important point, and I'll be coming to his paper at another time. This time we're just talking about what the facts are. The next time we'll look at what exactly is occurring. So Carlo Brogna has done a tremendous service to the world by breaking this. It hasn't been given enough attention, but I guarantee you in time we're going to start to understand just how important this is. So let's get back to this paper here. And so, as we said, it's important to understand that the gut microbiome is a huge biosystem and it covers the entire length of the digestive tract and it does multiple roles in terms of health and disease. And they've noticed that it is affected by COVID 19. Now, that in itself is quite remarkable because this is supposed to be a respiratory infection. Why in the world would it be affected in this kind of way? Really, really strange. So we have here the fact again that when we look at the gut microbiome, very important and intriguing biosystem, 400 square meters, and a biodiversity of over 2,000 species. So this is quite a complex thing, and it's a symbiotic relationship, meaning that yes, in disease, the microbiome can cause disease, but very often the gut microbiome is supporting us. It's helping to produce particular things that the body needs. So you can see here that they're highlighting that the contribution of the gut microbiome in the production of the vitamins, especially the B family and vitamin K, has become common knowledge. And more recently, with their rich endowment of enzymes, they can digest a lot of carbohydrates, they can digest a vegetable material, and they help the body to be able to get better nutrition. So, whilst they can cause disease in some specific cases, the microbiome is actually really, really important. So, in the context of this particular paper, they then went on to look at one of the other important points. So, they noticed this was from January 2020 in terms of gut manifestation in COVID 19. So, this is an infection and microbiome alterations. So, in the first wave in Wuhan, 41 cases, only one case was diarrhea, the presenting symptom. 3 months later, in New York, where you had the first 393 cases, 23% had gut symptoms. And they could see this variation across different parts of the world. And part of it may be because of the difference in terms of the gut microbiome. So they said, in addition, a Western diet rich in processed meat but deficient in microbiota accessible carbohydrates may have lower biodiversity. And so this seems to have an impact on the way the disease was able to present. More importantly, they found as well, in the context of severe COVID 19, it became obvious that gut involvement and diarrhea were associated with greater severity of COVID 19. And they looked at an investigation in Hong Kong, certain components of the gut microbiome with immune modulatory potential were depleted in severe and long lasting COVID 19. So you can see three particular groups were depleted by the infection. Really critical information. How does that occur? And what does it mean? So the next question you would ask is, if the infection can impact on the gut bacteria and the microbiome, would you potentially see something similar with regards to vaccination? That's a really important question, and they asked it here. So, in terms of the gut microbiome's impact on COVID 19 vaccines, efficacy, and side effects. So, one of the strangest things that they noticed here is that actually, when they looked at different vaccines, of the different vaccine recipients, this was Coronavac, low induction of neutralizing antibodies could be increased if there is a higher level of bifidobacterium. Now, how remarkable is that? And in the context, another vaccine, the viral spike protein encoded mRNA, this is the Pfizer vaccine, this was a Comirnaty, although capable of eliciting high antibody levels, could be further improved by the abundance of the flagellate and fimbriate bacteria. Again, this is extremely unusual. Why would bacteria have an impact on the efficacy of the vaccines? How does this work? This is not typical, and this is why I said origins are so important. This is clearly not typical of a bat coronavirus. This is really unusual. Going further, this is again impact of COVID vaccines on gut microbiome, a bidirectional interaction. So not only did they show vaccine efficacy could be adjusted by the microbiome, what they also found was that certain bacterial groups were increased. When you looked at the Pfizer vaccine, Bifido and Alistopes is another one that had increased after vaccination. And again, common to both vaccines, a large number of species were diminished across the microbiome. This is extremely unusual. Why would certain bacterial species become depleted in the context of vaccination? Now, this is why I said without an understanding of the science, how are you going to find solutions? Because we need to understand, how is it possible that the bacteria are impacted in this kind of way with regards to um, infection and vaccination? We don't see that type of pattern anywhere else. You may see it with regards to cancer. Say, for instance, here it points out that again, beyond COVID-19, vaccines may have therapeutic value well beyond their original intended effects. And we know that with the BCG vaccine as well. And so, therefore, you can have some degree of impact with regards to how some of these other vaccines work in different areas, but they're not particularly focused on bacterial changes in relation to some of these other immune mechanisms. And if anything, it can impact on the risk of cancer with regards to changes in the bacteria, but not vaccine efficacy. So this is really, really unusual. And in conclusion here, what they've said here, looking at it, certain gut microbiomes can enhance vaccine efficacy in antibody stimulation, while others have the opposite effect. Conversely, COVID-19 vaccines could impact the gut microbiome, enhancing the growth of some microbiomes, but suppressing the growth of many others. And so this leads us back to, again, what Carlo Brogna had found. And what he had found was that certain bacterial toxins started to be produced and could be eliminated by specific antibiotics. And again, that's such an important paper that I think I'll need to cover it quite separately. But here is my thoughts, and this is now just the exploration of the science. So, as I reflected on it, how could it be that we see a change with regards to bacteria? I've got here three options. One is that we know that the virus potentially seems to have bacteriophage properties. Could the virus then get inside the bacteria? And once inside the bacteria, the coding machinery produces toxins. And this is why I have these here in red. If it's not the bacteria, could it be the spike protein in and of itself? I'm not sure how the spike protein would do that. And it shouldn't be able to code for new toxins, but certainly the lipid nanoparticles with the mRNA inside, if it theoretically could get into a bacterium, would potentially be able to have an impact on whether or not these bacteria produce toxins. So one of the things, again, that Carla Brogna found was that there are about 36 different types of toxins, newer toxins that were produced by bacteria in relation to the production of RNA. And it's not clear how it's occurring. You're having increased levels of viral RNA. This is why we're seeing the wastewater samples increasing across the world. How is it doing this? There's not been enough research into this. And Carlo Brogna has been one of the few researchers in Italy trying to crack through what exactly could be happening. So here is what I think could really be occurring. Whichever way it seems that RNA is getting into bacteria, whether or not it's just the spike protein, whether or not it's the virus itself, whether or not it's the lipid nanoparticles or just free floating RNA, mRNA, once inside the bacteria, somehow it could allow them to code for toxins that they don't normally do. And just to clarify something, if you think about things like diphtheria causes disease with an exotoxin, but only a small percentage of diphtheria bacteria can produce the exotoxin. They need a bacteriophage to infect them, and then they can produce the bacteria that produce the exotoxin that can cause heart damage. So this kind of bacteriophage property has occurred in different diseases. And so this is effectively what I think could be also part of the picture. If you then had certain bacterial groups becoming able to produce extra toxins, they would decimate the other bacteria in the microbiome. And this is so very important because if they're able to deplete the good bacteria, because not all bacteria are on the good side, and that's what we learned from conditions like Clostridium difficile, that bacteria produces a lot of toxins, damages other bacteria, the overgrowth then leads to disease. And so if we have a similar pattern occurring across the world where both infection and vaccination are impacting on the microbiome, the outcomes of that could be horrific. Because you have to remember that whilst people may argue that we have situations where severe COVID-19 is reduced because of the impact of vaccines, it doesn't stop infection. And so, if we have a situation where the vaccines are having a critical impact on the microbiome and you have recurrent infection, this is quite a significant situation. We don't know where it will lead. There's so many levels that need to be understood in order for us to be able to get a grasp on how to find solutions. Main point is this: it's critical for us to be able to find answers. And to find answers, we have to ask questions and step outside of our comfort zone. We have to be willing to be objective from a scientific point of view and make sure that every single stone is turned. That's the responsibility from a scientific point of view, and certainly for anyone who is trying to find solutions, absolutely critical in order for us to find ways to overcome what could be another phase of disease that lasts instead of just a wave this time. Microbiome changes could be causing disease for the next 5 to 10 years. Still a lot of work to do. Have a great evening.